I'm Justin Tortolani, spine surgeon at Union Memorial Hospital, and I'm the director of the spine program there and director of our research and education as well as our fellowship program. We're seeing what seems to be an increased frequency of low back injuries, especially in young lacrosse players. And I think it's an intersection of growth as kids go through their adolescent growth spurt at the same time that they're unbelievably involved with intense play. Especially with club lacrosse, which is one of the only mechanisms for kids to play lacrosse now. We'll see, 3 or 4 games for 3 or 4 days in a row on a weekend. So it can be 120, 160 minutes of play, and then you're doing that 3 to 4 days in a row. And there's really no other athletes, even professional athletes, that have that kind of intense play, and that's even on a mature skeleton. So we're seeing this in lacrosse, and we're seeing it in other sports that have this similar kind of club tournament schedule. We know that some kids, especially as they go through their growth, their bone mineralization, their calcium content in their bone dips a little bit. And for example, we know there's a peak incidence of wrist fractures in kids that are 11 or 12 years old, not just because they're active and riding bicycles, because their wrist has low bone mineral density. So I think with better research, we're going to hone in on some specific risk factors. Stress fractures in general are more common in women than in men, but that isn't necessarily the case for lacrosse-related injuries. In my practice, at least, I see more men, I think because of the violence associated with the shot, and because the stick design, it allows them to exert a lot more torque through their trunk, whereas in women, they can have a very strong follow-through, but it doesn't really pay for them to wind up a lot in extension because the ball's going to fly out of their stick. We see it more commonly in offensive players who are shooting in lacrosse, but we still see it in defensemen, and I've seen it in goalies as well. And again, I think it just gets to, in certain positions, especially repeated rotation, you put a lot of stress on the junction between the low back and the pelvis. And because we're learning more about it, we're now able to counsel athletes about mechanisms to hopefully prevent it. How you can alter your wind-up a little bit when you shoot, and maybe altering your stick stringing a little bit, and maybe using more wrist snap to get force on your shot rather than trunk rotation. And the problem is a lot of young athletes don't have that instruction, don't have that insight. 3 months of rest is the formula to get kids back, and especially when we're talking about stress injuries or stress fractures, which is by far the most common. About 80% of kids will get back to really elite level play as long as they rest appropriately. And it's important that while they're resting, they're still keeping their strength and their endurance. And so that's where designing a program, a protocol with a physical therapist and with a rehab specialist to make sure they're not just sitting on the couch while they're resting. So it has to be a guided rest program. Most injuries will respond favorably to rest, and the prognosis is really good. We don't see a lot of disc injuries in young athletes. Their discs are so strong, okay? We don't see muscle injuries slowing kids down, and most kids don't even complain of muscle injuries. So if a kid has pain to the extent that they're going to tell their parent about it and it's lingering, it's probably something more significant than just a muscle pull. Some huge takeaways: if a child complains of 2 weeks or more of low back pain, they need to be evaluated with an MRI scan. There are numerous studies that show that there's about a 50% chance of a stress injury in athletes who have more than 2 weeks of back pain. The other thing that I think is important for not only parents, but for coaches, for anybody involved in the sport, to understand that the stresses that these kids are under physically are pretty amazing, and that there should be some awareness of the amount that a child is playing, whether it's a club team. Some of these kids are in club teams, plus junior high teams, plus physical education in school. So they can have 3 athletic competitions in a single day, or 7 days a week with not a day of rest.